day and welcome to Independent Television on Talking Politics. On Talking Politics, it is a program where we look at issues in the polity and most especially looking at the aspect of the loopholes, challenges in the political space. And this is a program that we are always trying to bring to the audience so that policymakers, politicians, and also the government in power will be able to take certain decisions. And I have a guest this morning who will be joining me on the program, who basically is a stakeholder, and not only that, experienced and versatile in the issue of drugs related cases in Nigeria. He is Ambassador Kenneth Aneto. He's the Executive Director, a New Thing International Foundation member, ad hoc committee on drug abuse, and also a member of the Presidential Committee for Elimination of Social Vices in Secondary School and Tertiary Institution. Welcome, sir, to the program Talking Politics.
It's a pleasure to be here. Thank you for this opportunity.
All right, let's look at the issue of drug abuse in the society, and I really want to know how far is Nigeria looking as a nation. Do you really think are we in a precarious situation, or there has been an improvement so far so good?
Well, substance use in Nigeria, according to the statistics that we have, we're looking at for every 7 persons in Nigeria, that one has used substances in the last 1 year. And for every 5 persons that has used substances, one has a substance use disorder. And for every 4 persons with a substance use disorder, one is a woman. And women go faster from casual drug usage to problematic drug usage because when they use substances, they use it with multiple partners. But in terms of the statistics for rehabilitation from a Nuendo study done in 2021, we are looking that for every 20 persons that access substance use disorder treatment, that only one was a woman. And what is the reason? Because women face stigma from fellow drug users, they face stigma from healthcare workers, they also face stigma during reintegration back into society when they finish their treatment. So looking at Nigeria as a nation, I believe that as a nation we have a collective responsibility to do better in terms of addressing the issue of substance use disorder. It is very quick for us to want to point everything to the government, but I tell you that this challenge actually starts from our communities. It starts from the smallest cell of our nation, which is the family. How do we perceive the issue of substance use? Because of our geo-religious or even geo-cultural biases and systems in these nations, when people hear that a family member has substance use disorder or is using substances, they are more likely to want to hide, want to conceal it or stigmatize the person, and this is leading to a lot of wonderful scenarios that are playing outside at the large extent, playing on the TV, playing in the businesses, playing in politics, playing in government. But the main issue starts from the home.
And the main issue starts from the home. And maybe issue of rehab. We know how rehab is in the country. We may say the facilities is not available, or the stigma attached to you are just coming out from a rehab. So do you think that should we focus on the rehab process, or we should try to do advocacy enough rather than the rehab?
When we talk, there are a lot of stakeholders in that value chain. The media has a responsibility to inform the mindset of people. So you giving us an opportunity to talk right here today on your platform, you're actually doing your part. You're letting people know that substance use disorder is not a death sentence, is not a criminal justice problem, but is a public health challenge, because there's so many issues that can cause someone to go into substance use. When a person is coming for a family where family members are using substances, it can make the person be interested in experimenting. When a person has had trauma, when a person has been abused, either violently or either sexually, the person might want to use substance as a coping mechanism. Some people are dealing with sicknesses, with life-threatening and pain-causing sicknesses, sickle cell. Some are dealing with other forms of cancer and are using this as a coping mechanism. Some people come from a family. In Harvard Medical School, there's something that spoke to us about the neurology of addiction. A professor said that if a person comes from a family where there is prolonged use of substances, some families, they give us example, they say the grandfather was an alcoholic, the father is an alcoholic, now the son is now using alcohol. The person that comes from that family, when the person uses such substances, the person will not feel the same way that someone comes from a family that they don't use substance. if the person is in an environment where people are smoking and their family are used to smoking, when the person inhales it, he doesn't inhale it and feel like someone that, what is this? It seems familiar, because substance use disorder is a chronic relapsing brain disease characterized by a person going after a particular drug of choice, regardless of how it affects him, how it affects his family, and how it affects the society. So those parts of the brain that are damaged sometimes are transferred to the next generation. So the media has a part to play. We also have the law enforcement agencies. When we talk about the NDLEA, they have that drug demand reduction and supply suppression. They have that part to address and curtail the activities of the transporters, the producers, the manufacturers, the the sellers of these nefarious things. And they also have the supply suppression. I mean the drug demand reduction, where they go out and they cancel individuals. They have the part of NGOs, civil society, and faith-based organizations in giving messages from the pulpit to let people know that this challenge, it is not a death sentence. There are ways that you can take care of these things and you can get help, either spiritual or physical help. We have the plate of the caregivers. The caregivers in Nigeria need to be reorientated to begin to treat these people like human beings, because it is a public health challenge. It is a disease, not immorality. It is not someone trying to be vulgar. It's not somebody rebelling and want to be a cultist. It is a disease, and some people are predisposed to already use this type of substances. So we need to begin to look at it from there. We have other stakeholders. We have the stakeholders at the offices where the policies are being made, the Ministry of Health. We finally I thank God for this thing, for our President Bola Ahmed Tinubu, for his proactive investment in healthcare services. And this is the first time that Nigeria is actually having a national alcohol policy to address the challenges of alcohol in this country. They have been meeting for the past 5 years, but last month we were able to actually have a working document. Now, the Speaker has even put together a committee called the Adult Committee on Drug Trafficking and Abuse to address why substances are being seen in the country at this time. I believe that everybody has that part to play, whether you're in education, by educating people, whether you work in the media, whether you're an entertainer, portraying these substances as a lifestyle is not good. You have to begin to do your part, because this is the Nigeria we have, this is the nation we have, and we'll raise our children here. So help us, God.
All right, amen. I'll say a big amen to that. But are you of the maybe at that particular side where looking at drug tests and the negative reaction and the adverse effect of drugs? I mean, do you think people who aspiring politicians, students who are coming back from school? I remember one time the NDLA DG Buba Marwa, this stated that they should undergo drug tests. Even there was also a report, and I can also that husband and wife before they get married, they should be drug tests. Are you in support of that?
First of all, anybody putting needle inside somebody's body or taking samples from the body without the person's permission, naturally, I'm not prone to. So that's my own personal life.
Okay.
And they don't call it like drug test, they call it integrity test.
Okay, integrity
It is
test.
meant to be an integrity test, but I feel that it is subject to people of a certain age and people, and I feel like that it can be used as a tool to go after enemies.
Okay.
I believe that the process, it's a good idea. It's a nice idea. It will help to develop integrity for people, integrity for students, integrity for spouse, integrity for politicians. But I just feel about the way it can be hijacked.
Okay.
It's being hijacked and used as a tool to fight
A negative
students,
tool.
to muscle students to pay money. Because even if they see this guy has money, this, they can just say that let's do his own positive, and the guy comes and sees his positive, it can be hijacked. The process could be hijacked. Even in terms of political rivals, it can be hijacked to use as a tool against political rivals. So if the integrity can really be put in the integrity test, is a nice idea. For marriage, you want to marry somebody, at least the person, you might never know. They say you don't know everything until you enter inside marriage. So it's a good tool. But I believe that if the process can be streamlined and done well, if it is not hijacked, and we have seen a lot of processes being hijacked around the world, something that came out for something was now turned into something, and at the end of the day, we are wondering, was this the real origin or the purpose of this thing? So if it's not a hijacked process, we believe that it can be a good idea.
All right, let's go for this short break. When we come back, my guest is still here. We'll be able to look at the other side of the program on Talking Politics on Independent Television Abuja. All right, well, let's look at this aspect of advocacy that you have done, your agency, and most especially collaboration even with the international community. Do you really think is it easy for you to penetrate? Because in some hostile areas where people, you see them smoking this weed and they are used to drugs, assorted kind of drug, the tablet, how have you been able to penetrate? Because I see that there are some stretch when it has to do with the evidence of drug addict. Are you being manhandled, or is it easy to penetrate, especially the localities, to for advocacy on them to just kill that habit?
Nigeria is a very wonderful nation, but we are one people.
Okay.
And addressing these situations are something that has to do with a lot of passion.
Okay.
Like you coming to talk about sensitive topics, you are doing it because this is your calling, this is your passion, this is what you were meant to do. And me talking about this issue, taking it to nooks and crannies of this nation, is what I've been called, what I'm meant to do, what I've been doing. And our organization has been opportunity to do it at the grassroots level, at the National Assembly, and at different geopolitical regions for the last 10 years. In this year alone, we have been in Maiduguri, we have been in Sokoto. Last year, we were in Kebbi, we were in Jos, we were in Imo. This year, we've been in Imo again. We are always in the areas where we are meant to be, where the resources have been made available, and where we have projected that we are meant to hit. Regardless of the situation, regardless of what happens, it's like a soldier in front of the war front. He has to be there. And the understanding remains important, because the way you address the issue is the way you will be received concerning the issue. When we address this issue, we don't address it as if we're fighting. We address it as intelligent people using evidence-based methods to address this issue. So, because this issue it happens around the world, okay, there are other situations that these things have happened. So we have been trained the right way to respond in those type of situations. We've been trained by the United Nations Office on Drugs and Crime. We've been trained by Harvard Medical School. We have been trained by NDLA. We've been trained by Community Network on drug abuse. Every quarter, we are trained by West African Drug Policy Network. So we are equipped to handle situations. When we work in communities, we have individuals that are part of the communities we work with. When we get to those communities, we empower individuals not to just receive information, but to also be our outstretched arms, okay, going to those communities to continue to drive our messages. So it is not them saying, this is a stranger. They are looking at individuals that they know, but coming with that message, because there are other individuals that have the same passion with us that we have. Remember, for every 7 persons in Nigeria, 1 has abused substances. That means that for every compound in Nigeria, there's someone that abused substance. And for everybody that abused substance, there's a brother, a sister, a mother, a father, a uncle, a relative, or a friend that is concerned. If you can reach one of each of those concerned individuals and equip them with information to keep their community safe, then we have our foot soldiers driving the message of a drug-free nation, driving the message of prevention across the whole of Nigeria.
Okay, that is the size of the show, Talking Politics. Catch us next week when we will be bringing you another edition of the program. Bye-bye.